Hello, everyone, and welcome to our weekly staff meeting of nurses. We are Group 3, and our hosts for today are Javier Palmer, Sarafina Henry, Shania Russell, Jodian Kelsey, and Kerrian Blackwood Barnes. On this week's episode, we will be discussing the world famous theorist Dorothy Orem and her self care deficit nursing theory. Now, first and foremost, who was Dorothy Orem? Dorothy Orem was an influential American nurse, theorist, and educator, best known for developing the self-care deficit nursing theory. Orem received her initial nursing education at Providence Hospital School of Nursing in Washington, D.C. Now, Dorothy Orem's self-care deficit theory is one of the foundational models in nursing, providing a structured approach to understanding when nursing care is needed and how it should be provided. The theory emphasizes patient autonomy and nurse intervention only when necessary, making it a cornerstone in modern nursing. Now, Dorothy Orem's self-care deficit nursing theory integrates three interrelated theories: the theory of self-care, which emphasizes that individuals must learn and develop skills to care for themselves; the theory of self-care deficit, which addresses the circumstances in which nursing care is necessary; and finally, the theory of nursing systems, which explains the role of nurses compensating for or aiding in the patient's self-care needs.
The theory of self-care. The central idea describes self-care in contrast to other forms of care. Self-care, or care for oneself, must be learned and be deliberately performed for life, human functioning, and well-being. The three core components of self-care are universal self-care, developmental self-care, and health deviation self-care. Universal self-care. This refers to the fundamental self-care needs that are common to all human beings, essential for health and well-being, such as food, water, shelter, solitude, activity and rest, and social interaction. Universal self-care is linked to the preservation of the human structure and its functioning, as well as the prevention of threats to human life, such as keeping crib rails up for infants and amputation safety for adults. Developmental self-care. These are needs that arise during specific stages of a person's life or in response to life events, such as growth, development, or major life transitions. And finally, health deviation self care. This refers to self care needs that arise when an individual is affected by illness, injury, or medical conditions. These requests involve managing the effects of a health deviation, such as seeking medical care, following prescribed treatments, or adapting to the limitations caused by the condition. The theory of self care deficit. The concept of a self care deficit arises when a person is unable to meet their self care needs due to limitations such as illness, injury, disability, or lack of knowledge. According to Orem, when individuals cannot care for themselves sufficiently, nursing care becomes necessary to help them overcome these deficits and restore their health.
Orem identifies the five methods of assisting a dependent individual. They are doing or acting for another, supervising others, supporting others, offering an environment that promotes personal development in relation to meeting future needs, and educating others. Now, these methods enable caregivers to address current needs and foster future self sufficiency. Doing or acting for another. This applies when the patient is entirely unable to perform certain self care tasks. For example, if a patient is unconscious, the nurse must take overall care functions, example, feeding and administering medications. Supervising others. The patient can perform some self care tasks, but needs guidance or education. For example, a newly diagnosed diabetic patient might need instruction on how to monitor blood glucose levels. Now, Orem self care deficit theory identifies supervising others as a pivotal method of support wherein healthcare providers guide and educate patients who possess some capacity for self-care but require direction to enhance autonomy.
Supporting others. Nursing provides emotional and psychological support to encourage the patient to engage in self care. For example, a patient recovering from depression may need encouragement to perform daily hygiene tasks. Orem's theory supports the methodology where nurses empathize, provides emotional and psychological sustenance to empower patients, which reduces anxiety and fear and enhances patient self-esteem, which promotes the engagement in self-care tasks. Offering an environment that promotes personal development in relation to meeting future needs. Nursing creates an environment conducive to healing and personal growth. This environment consists of patient-centered care, for example, ensuring the patient hospital room is comfortable and stress-free, which helps in the recovery process. Educating others. Nursing educates patients so that they can better take care of themselves or take over self-care responsibilities once they regain their capacity. For instance, a patient recovering from surgery may need to be taught how to take care of an incision or manage a rehabilitation plan. The theory of nursing system. The central focus is the product of nursing, establishing both structure and content for nursing practices as well as the nursing role. Nursing care becomes necessary when individuals are unable to meet their own self-care needs, either fully or partially. In this system, nurses identify self-care needs, they determine self-care deficits, and develop nursing diagnosis. They also plan and implement nursing intervention and evaluate the outcomes of these interventions.
Harms identify three types of nursing systems: wholly compensatory, partially compensatory, and supportive educative. Wholly compensatory system. In the wholly compensatory system, the nurse performed all necessary care because the patient is entirely unable to do so. Partially compensatory system. In a partially compensatory system, both the nurse and the patient share the responsibility of care. Supportive educative system. In the supportive educative system, the nurse role is to teach and support the patient in performing self-care. Additionally, the supportive educative system also allows the patient to be more involved, in self-care in terms of making informed decision formulating durable self-care and wellness. In conclusion, Dorothy Orem's self-care deficit nursing theory is structured around the idea that individuals have the ability and responsibility to care for themselves. But nursing intervention becomes necessary when there is a self-care deficit. The theory provides a comprehensive framework for nurses to assess patient needs and determine the appropriate level of intervention, always with the goal of promoting self-care independence where possible. We have come to the end of our presentation, and these are our references. Thank you.
We will now role-play two videos that illustrate the legal principles of assault and implied consent within nursing settings, while demonstrating the application of the self-care deficit nursing theory.
Hello, good afternoon. Good afternoon. My name is Nurse Barnes. May I see your hand down, please? Okay, Shania Russell. Which name do you prefer to be called by?
Shania Russell.
Okay, Shania Russell. I am here to administer your medication. I realize that you have just come out of surgery, so I'm going to provide some courtesy. Your medication is in the form of an injection. So I have to give you the injection so that you can recover from your illness.
What nurse, I'm feeling better, don't really need any injection right now.
But I have to give you the injection.
But I said I'm feeling better, I don't want
it's
to.
supposed to help you to
But I
get
said
better.
I don't want to.
But you don't have a choice.
But I don't want it.
for
Do
your
not touch
recovery.
me, I do not
No,
want
Nurse
it.
Lauren, Nurse Lauren, no, you cannot administer medication to a patient with his or her consent. That would be an assault.
Okay, you have a point. You're right in on her policy. Shania, I'm so sorry. I know that I've crossed my bound, but I am asking for your forgiveness. Am I forgiven?
Yes, you are.
According to Orem's theory, this patient is experiencing a self-care deficit as she is temporarily unable to take care of herself fully. The nurse is acting in line with the partially compensatory system of self-care deficit theory and is trying to help. However, the action displayed by the nurse disregarded the patient's express refusal and persists in proceeding, which can be considered assault in the nursing context.
In accordance with Orem's self-care deficit theory, care should respect the patient's autonomy and the ability to make informed decisions as they recover. The nurse's failure to listen to patient refusal not only violates ethical boundaries, but may also lead to ethical consequences as administrating care without consent, particularly when patient is capable of making decisions. This breaches their rights and dignity.
Patient vitals are unstable. We need to start an IV and administer possible fluids. Prepare for intubation. We have to act now. Yes, implied consent is applied here. The patient is unconscious, but is clear to need this intervention in order to survive. Exactly, according to protocol, I'm sure he'd want a life-saving treatment. We have to act now. We are doing what is best interest of the patient.
What happened next?
You're in a hospital, you were in an accident and you were unconscious. I had to administer some IV to stabilize you. And now I can see that you're better, and I'm happy you're better now.
Thank you, nurse.
You're welcome. We acted based on implied consent since you couldn't speak for yourself. Your safety is our priority. In this scenario, the nurses acted on implied consent because the patient was unconscious and unable to communicate their wishes. Following Orem's theory, the nurses stepped in to address the patient's self-care deficit by providing the necessary intervention to stabilize the patient and preserve their health. The actions of the nurses also fall under the rolling compensatory system, in which the nurse is providing all necessary care because the patient is entirely unable to do so. Their actions are aligned with the ethical standards of providing the least invasive, life-saving care in the patient's best interest. Once the patient regains consciousness, the nurse explains the action taken, reinforcing transparency and respecting the patient's autonomy once they are able to make decisions again.
Nurses must carefully navigate between fulfilling their duty to provide necessary care and respecting patients' rights, avoiding actions that could be perceived as assault while ensuring that implied consent is appropriately applied. Clear communication, ethical decision-making, and transparency are key to upholding both legal and professional standards in nursing practice.